Hello everybody. Thank you so much for joining our conversations on Paza. Paza, a Swahili word meaning to amplify, is an initiative by Disability Trust. Paza seeks to document and create visibility for the experiences of women with disabilities globally. We look forward to hearing from you, so remember to share your support and feedback on our social media platforms. To continue this conversation, please follow our Twitter page at Paza Podcast. For more content on disabilities work and projects, please follow Disability on Twitter and Instagram at this_ability_KE and on Facebook at disability.ke. Now, let's get into today's topic of discussion. So thank you so much, everybody, for joining. So I would just like to start with a round of introduction. I'll start with you, Ash.
This is Aishwarya Rai. I'm a pediatrician and I'm a woman with a locomotor disability. I'm calling from Chennai, that is in South India. So that's about me. I run a shelter for women with disability in Chennai. We have about, at any point of time, 60 women with all kinds of disability staying in the shelter with us. And what we are looking for primarily through the shelter is employability of women of different capacities, better employment opportunities. So that's about me.
Great. Thank you so much, Ash. And Sophie?
Hi, everybody. I'm Sophie Morgan. I'm from the UK. I'm a disability advocate and also an activist campaigner. I work mostly in the media myself, advocating for better representation for disabled people, but also work in retail and travel to help improve representation there for disabled people too. So yeah, I'm based in London.
Thank you very much, everybody. And for those who do not know me, my name is Lizzy Qiyamah, and I am the managing trustee of Disability Trust. I founded Disability in 2012, and our focus has always been advancing the rights of women with disability. This whole coronavirus thing got us thinking in terms of how communities of women with disabilities are responding, whether this information is reaching them, whether they have the necessary support and resources to navigate through this pandemic. But also on the flip side, we were thinking about the various recommendations that are being given in terms of trying to not get infected, the social distancing, the isolation, and how women with disabilities have had to build these skills over the years because of a very inaccessible environment. Can we just get right into it? Because we would love to know, what is coronavirus from a medical standpoint?
So coronavirus, there's just too much of information overload about the virus everywhere, as a lot of us have been reading and hearing about it. But the simple facts of the coronavirus is this: the coronavirus is a respiratory virus. It has always existed, but what we are dealing with right now is the novel strain of the coronavirus, and it is an exceptionally very infective infection. It started in Wuhan, China. It's a zoonotic infection, which means the virus existed in wild animals, probably bats, and because of a mutation that rendered it very, very infective, it jumped from the bats into the human population, and from then on, it has been increasingly spreading from one person to another at an alarming rate. The common symptoms are very, very common, just like any other flu, like fever, upper respiratory, sneezing, cough, but lung infection. But the one thing that distinguishes the novel coronavirus or the disease or the COVID-19 as it's called is that there is a mortality rate of 1%, at least 1%, but the mortality rate will differ depending on which healthcare setting you are in. Facility in Canada will be very different from a rural facility in India, for example. But at this point, from whatever data that health authorities have been able to combine, they say death rate of 1%, which is very high in a highly populous country like India or some of the countries in Africa, I would assume. So this is it, and it is spreading alarmingly. More than 166 from this. In December, there was only one. The first case was reported first week of December in China, but today All 166 countries across the world have reported, and some countries more than other countries. So it is as we speak, it's a global pandemic, and it is spreading more and more.
Right.
I think these are the basic facts.
Thank you, Ash. Could you maybe speak about the experience in India?
We are behind the global epidemic, so we are still epidemics have four phases. One is people who came into from the epicenter, people in either China or the very high prevalent countries like France or Italy. So that is the first phase of the epidemic, and the second phase of the epidemic is contacts their family members or anybody that those people who actually tested positive for coronavirus who have come into contact with them. So right now India is only at phase 2. We are only seeing new infections. Like all of India, we have 1.3 billion population, but as of today the country has notified only around 160 cases. So it's very, very early. But in the days, in the next week or even the next 2 weeks, we expect like what the health authorities, like the foremost virologist in India, Dr. Jacob John, he said that it's going to be an avalanche of cases because of overcrowding, poverty, and lack of access to healthcare. We are going to have a huge problem on our hands. Right now, most of the Indian population has heard about it. We're getting a lot of information, but still we are in a state of denial. We're thinking, there's just too much. They're making a big deal out of it because we haven't really experienced the tragic part of the epidemic. We're not seeing the country, the apex body come up, put everyone on board, increase testing and awareness. See, for example, last week we had this information that went out and about coughing and keeping a safe distance, the general precautions, but that was all issued in one language, Hindi. Only about 25 to 30% of the country speak the language. Most of India does not speak Hindi. And all our telephones, whenever we called, we had this caller tune with this Hindi message. So most people didn't understand. So it's like extremely poor, uncoordinated effort by the government, and we really don't know what is going to happen. We are watching. So every state has its own separate response. Some states are responding better. My state is the southern state of Tamil Nadu. We can't say it's very poor, but we are also not the best. We should do more. So this is India's story, and we are very, it is frightening actually.
And what about the women in the shelter that you coordinate? What's their experience like?
Yes. The shelter, it's very funny, but the women in the shelter are all, because we spoke to them about it, and they're all the women with disabilities are always on cell phones, and they're accessing information. So they're all aware of this information. We have all the children there, or the college ones, they're not going out, they're staying in the shelter, and we are advising the same, hand sanitization, and staying at least 3 feet apart. So general precautions as of now, no symptoms, luckily. So we're just waiting, nothing more than that. Also travel, a lot of the travel is suspended. So a lot of the women who want to go back home haven't gone back home. They're just staying at the shelter. So we will wait and see what will happen. We have not been provided masks because masks are in very short, high demand. Also, it's not necessary yet because none of them are having any symptoms. But even there is a shortage of hand sanitizers. So we as of now we have some stock, but we rely on water and on soaps and stuff like that. So I think we are somewhat prepared. We should be more prepared, but we will, we will get to that level of preparedness when we hit that bridge.
So in terms of preparedness, you're left to your own resources. Is the government supporting you in any way?
Absolutely. No, they're sending us information, do this, clean this, and provide masks and do this, but they're not doing anything. They're just policing us. The government itself is pretty much confused. There's no one person calling the shots there. So no,
Right.
we are not having any support from the government authorities yet.
Okay, interesting. Thank you for that brief explanation of what's going on in India. Sophie, would you like to
Hi.
share? Hi, would you like to share what's going on in the UK? And also, if you've come across any innovative solutions that are connecting persons with disabilities with this critical information and access to services?
It's got quite bad over here. I don't know how many cases that we've got, but basically London's just gone onto lockdown, and there's a lot of procedures and structures coming into play that stop people from coming in contact with each other. So government guidance has been very much that we need to socially distance ourselves from each other, and that's meaning a lot of people are working from home. What we have seen, unfortunately, is that the government hasn't put yet an outright ban on going into some of the public spaces. So, for example, pubs and restaurants have been advised to we've been advised not to go to them, but many people still are. And so we're expecting there to be a full lockdown, kind of in the same way that Italy has seen its population locked down and kept at home. We're expecting that kind of same measures to start to happening here. But at the moment, there's a lot of responsibility being put on the population themselves. And what that does is because a lot of the responsibility is being put on population itself to self-regulate how to manage this. What we're seeing is that people are going, well, it's not really my problem. I'm not vulnerable. I don't have a disability. This is for people in the communities that, it's not me. It means that it's putting that particular community at huge risk. So a lot of disabled people are coming out trying to educate people as to how, vulnerable they feel and how important it is that we all look after each other at this time. And that being said, it's also been really interesting to see how the community here, the disabled community here, have responded with advice and guidance onto how to best manage being at home and spending time at home. And actually, we as disabled people, disabled women, have a lot of experience of being isolated, of being at home, of not being able to get to work, of having to prioritize their health over everything else. So as our communities are starting to experience the same thing, we are able to say, look, we've been here before, we can help you, and don't look to us as just vulnerable and the one that needs to be looked after. We in turn can look after you at this point mentally. We can give you tips on how best to structure your day and manage your well-being and things. So it's been a really interesting few days and weeks, and of course it's still unfolding and changes are happening rapidly. Every day we're getting different government advice, so a lot's going on. But to answer your other question about how we're sharing information and really what's being put out there for disabled people, what I have noticed is we are leaning on each other, and we are taking information that is being put out by the government, and we are trying very much to decipher what is relevant to us. As I said before, unfortunately, because the government has not issued more hard guidelines yet, a lot of the able-bodied community is kind of just saying, right, well, that's their problem, and that's leaving us a little bit vulnerable, but we know how to look after ourselves. So we're leaning on each other for advice and help, and a lot of community support networks are cropping up so people can help those with disabilities. We're seeing really amazing measures such as pieces of paper that are being distributed on social media that you can print off with information on how to educate people around you if you have a compromised immune system and you don't want to have someone come to your home that could infect you. Pieces posters that you can put onto your walls with information on how to educate them as to not infect you. So information and support is really rapidly spreading through social media, which is really exciting to see and encouraging, because it can feel very isolating right now.
That's true. But I love the fact that we're also able to shift that narrative from the charity and the vulnerability that mainstream society is used to
Yes, yes.
placing people with disabilities, and now we're shifting it and saying they're actually best practices that society can borrow from the disability
And I
community.
find it really interesting. You know, I don't know about you, but I've watched, you know, a number of celebrities around the world that I follow on social media, and they're all day 3 on quarantine. Oh my gosh, I can't handle it. And they're all melting down, you know, oh, what am I going to do? And I'm like, hey, I've done this for years. And, you know, it's kind of funny. We're all sort of going, come on, where's,
Yeah.
you know, man up here. This
Yeah.
is really, really interesting. So actually, whilst, you know, we're watching the world kind of course, there's very justified to be worried about what's happening right now. That fear is justified completely. But the coping with the working from home is really interesting to watch. Another thing, an unexpected consequence that is yet to play out, and I'm interested to see, is how the world is having to adapt to people working from home and adapt to situations which disabled people have been in for a long time. Is that going to change the way that businesses actually encounter us and organizations look after us? Are they going to see now that they've seen all their employees having to work from home and manage themselves from a different working environment? Does that mean that we're going to see different changes when all this comes to an end, that will mean that disabled people can fit into the workplace a lot more effectively? I don't know. It's exciting. I think there could be some silver linings here. It's early to say, but I do see it's interesting because I've had a number of people reach out to me and say, you don't realize I lost my job last year because I had to work from home because of illness and disability. And now all my colleagues are working from home. This is real, really, there's some consequences to this are really quite interesting. So yeah, we'll see what happens.
I'm also seeing the fact that there might be a silver lining to all this, and probably this pandemic will bring us to ground zero and allow us to build systems that are truly inclusive for everyone and that work for everyone. So
absolutely, and for once we might see that this vulnerability that we all have as human beings, but many take for granted, we can see that the disabled who live with this can think in a very different way. I mean, it really could bring to the forefront a different perspective that vulnerability is strength, that opportunity is found in adversity, and disabled people are so resilient and so adaptive when it comes to having to live in a world that doesn't suit their needs. What can we teach the wider world about that? One thing I was interested in hearing you talk about, Ash, just then is disabled women. You were saying a lot of people are on their phones, and I don't know about you guys, but I'm on my phone right now all the time. I mean, everyone's saying it's not healthy to spend a huge amount of time on social media, but that's just really hard to do, to not be on it all the time. And I wanted to know if any of you have found a really good hashtag or one place the way we can disseminate information through, because at the moment that I haven't seen that here in the UK. It's more we're sharing accounts or people that might have a good voice, or if you have charities or DPOs that know a little bit more, we can signpost to that. But have you seen anything a bit more disability focused?
To answer Sophie's question on whether there's anything specifically for information on disability and the epidemic right now, a bunch of us, we call ourselves the Disability Rights Alliance in India, activists from all over India. It's a very loose social media group. So we put out a website on WordPress. It's a very small blog. We call it the AIDR, AIDA, Addressing and Including Diversity in Emergency Response. Just a one-page website, but it contains all the links from government sources, WHO, CDC, etc., with some information, very little. We just wanted to put everything in one place. So we'll be adding to this. So this is an effort from the disability community for providing information for someone with a disability and coping with the current situation.
That's really, thanks for, I'd love to share that here in the UK as well. And of course, after this, we can all connect and share what we've got resource-wise. I just feel there should be a global coming together of all of us, like we are here now doing that. We should bring in as many partners as we are all connected to, because I do feel that the disabled community, whilst we are the ones that are being talked about as being the most vulnerable, especially here in the UK, that's the conversation at the moment, is that this virus is particularly threatening to that group of people. Everyone's talking about disabled people and vulnerable people. It's very important that the information gets to those particular people, and that those people speak for themselves about what's going on and what they need to know.
Another, like you all mentioned, I did a search on Twitter, disability and the current situation. And the only thing that it threw for me was this work from home. Lots of people are talking about how people with disability have always propagated working from home and how it is so doable. So this is the only context in which disability is appearing on Twitter feeds here in India.
I want to add just something little, because what I think is that we also need to be specific about how women with disability, not all people with disabilities, is like how women are handle it. And I think, there are two important things. Actually, women with disability usually, are more isolated than men with disabilities. And actually, I can talk a little bit about Kenya and about Latin America. Them usually do the care job at their homes.
Mm-hmm.
So now, I think for some of them, if it's true, there is now we have the opportunity to learn about how to handle the isolation. Also true that some of them are in really vulnerable conditions. Actually, I was reading something the last week about how women with disability are trying to handle the violence at home. The gender-based violence at home. Because now that in some countries, everybody's at home all the day, they get anxious, and usually the violence is against them. So I can tell you, for example, and I think that's important to maybe to share, in Colombia, they open a hotline. There are women with disability, picking the phone, but they are giving support to other women with disability who are suffering violence inside home.
Mm-hmm.
And I think it's very important to share this kind of experience, because in some point, maybe we should start with to do things like that, because women are not in the same situation than men with disability in the middle of this crisis.
Really good point. All of the issues that women in general are facing now, in increased violence, gender-based violence, disabled women are disproportionately affected by that. I think that's such a valid point.
And actually, for example, in some countries in South America, when somebody needs to go to the hospital, it's not the woman. They let the woman for the second or the third option. And when a man is sick, everybody goes with him to the hospital. But when it's about women, they don't have the same chances to go to the hospital. So I think we, like women, are in different conditions than men. And for sure, women and girls with disability are in a more vulnerable conditions.
That's definitely true. I'm not sure what is in place in terms of emergency preparedness from your various governments, but I can speak for Kenya. And women with disabilities are virtually invisible in programming and policy. So to even allocate budgets that speak to the reality of women with disabilities and their needs is non-existent. In refugee camps, for example, things like, or issues around sexual and reproductive health are not taken into consideration because it's not something the government has prepared for. So I'm curious about what your specific governments are doing from a social protection standpoint to ensure that maybe not only women with disabilities, but women in general are able to access services that they need on a day-to-day. Is there anything in India or the UK or Ecuador?
Well, speaking from the UK, I have to say, we are in emergency response mode, it seems here. So as far as I'm aware, so little is being done. There's measures being put in place, but it's got to be done quicker. And of course, the community itself is recognizing that women with disabilities and girls with disabilities are disproportionately more affected by things like gender-based violence. And so therefore, everything that's going on right now, we're particularly vulnerable. But the problem is that we've got so much to deal with. The country is in lockdown, is in panic. The army's being brought into London to start controlling people. It is really, really, rapid response. So the answer is from me here. I think that we're not there yet. We're not ready yet. We aren't prepared to help, and we're doing the best that we can, of course. But I say we. The government is doing the best that we can. But, you know, it's early days. And of course, at the moment, the real lived experience is a terrifying one for so many disabled people.
Yeah.
Lizzy,
Yes.
we can also see that the government is trying also to train the nurses on how to handle the coronavirus. But for women and disabilities, when you go to the hospitals, you can find there's no sign language interpreters for the deaf. There's no accurate accessibility to the hospitals.
Yeah. Yeah. That is a reality.
You find the women, they go and fetch water from the river. And then here they are being told you need to wash your hands with running water. So this is a woman with disability who depends on somebody else for such kind of services. So what is the government? And you know, with all the money that is coming in, they have not even thought about this part of the population of Kenya, that they need to be included in whatever budgetary allocations that are taking place, whatever aid that is coming in to fight this particular epidemic. Because you're being told to sanitize, even in the urban areas, the middle income earning class. Right now, the prices for the sanitizers have really skyrocketed. They're not even available. So how is the government expecting a woman in the village to be able to access this kind of things? So I also believe that whatever information is being passed, it is too elite. It is not really speaking to our women with disabilities in their real, actual, it's not real. It's a bit up there, you know?
And a similar story is being told here in the UK that even though, yeah, like you say, that the hand sanitizers are being bought by other people, and women with disabilities, people with disabilities are not being able to get access to that either. And actually, you know, masks are being taken, all of the resources and all of the things that are needed for the day-to-day lives of disabled people are being taken away, or the price is being put up. And other people are stockpiling and hoarding that and taking it away from people. So the government might be putting measures in place, but other people are taking advantage of it. So still, once again, disabled people are being left behind.
Yeah, yeah. And also how this information is spreading. Like, I'm on social media, so I get a lot of information like on Twitter and other social media platforms, but very limited information is being shared on mobile phones. The majority of the population in Kenya has access to those, but internet, if you're in a remote area, you don't have access to internet. So even how this information is being shared.
I said earlier, they are realizing that there are people hidden away. Thousands of people are hidden away with disabilities now that everyone's retreating into their own homes. So there is more of an awareness or a sympathy, but still the resources aren't going to get to those people without the right support to get to them, if that makes sense. It's still, you know, there's an awareness being raised, but yet people still don't know how to get the resources there.
I just want to, you know, jump in right now and talk about how social distancing in some contexts for people with high care needs, like a child with cerebral palsy or somebody who's completely dependent on caregiver for everyday living by family members or somebody assisting them. How are we going to do this social distancing? How is that going to work? So there's no word about it. You know, anywhere, any advisory has not come up. Just a mention about how that can be done is not there. So I find that extremely, you know, upsetting. So that's one thing. And also I'm wondering about when we go into isolation, about our mental health, somebody who's isolated, how it's going to affect somebody who's already having you know,
Like
panic
psychosocial
anxiety or depression actually
so,
too.
Yes, depression, and especially somebody who is suicidal, but you're isolated and you need to see somebody. I mean, how's that going to work out in the days, in the weeks to come? So I'm just wondering what we're going to uncover here.
I really feel it's going to have to come from us.
I definitely think that it comes from us, unfortunately. I actually like the flip side to this whole pandemic is because it's forcing us to look inward and to not
Yes.
rely on Big Brother to solve our problems. We have to learn how to be self-reliant. I don't think fear should be part of it. We need practical solutions, which we get through our networks, and this could be a network. I don't know.
Yeah.
I'm just saying, but I'm just like the large organizations. I would be worried of trying to get them to support, because they're also looking at the mainstream. They have to solve problems that affect a large group of people, and people with disabilities for a long time, they have not considered them a significant population. So why would they start now? I think it's on us.
Of course, it's up to the state to guarantee everybody rights, but now it's also time to learn about the supporting networks. And I think the feminist, and I'm sorry, but I'm a feminist, but the feminist movement since the last 2 centuries can teach everybody a lot of it. I mean, women, we know how to support each other. And I think now we cannot wait a lot from the states. So it's now also the time to build supporting networks all around.
So can I ask, in light of that, what would you say is what is the information that you think we need to spread first? Is it about the basics of how to protect yourself and sanitize and look after your well-being on the basic level? Is that not getting through? Is it about how to manage when you're self-isolating? Is it where do you think we could start? Because I feel very much in agreement. Women can help each other here. Disabled women can help each other in particular. But what do we need to identify? Where do we start?
So for me, I think centering women with disabilities in this discourse is critical. Like there's things that, for example, Ash, what you're talking about, a child with cerebral palsy who needs help from a caregiver, and the information that is being shared by government on how to protect yourself does not include a disability aspect. It's within this discourse is important. And whatever information is being put out there, whether it's sanitation and hygiene and whatever it is, how do we apply a disability lens to that? And how do we look at it from a disability perspective? How would a deaf person, a blind person, somebody in a wheelchair,
with a lung disease,
exactly, how would they respond to this information? How does it make sense for them? So this is just my take.
I would first of all emphasize or demand that all government information, their websites and their announcements. Today evening, our Prime Minister is set to talk to the nation, and I'm just looking to see, but he sent out a PMO office a letter saying we want sign language interpretation for his speech. But again, vast country like India, we don't have one sign language that everyone understands. So there are those challenges there. But we must insist that every information coming out must be inclusive. That's one thing. And then general information. And how do you make all the hand sanitizers? Because washing is again a very big challenge for a lot of us, especially the limited mobility people. So that you must have access to sanitizers and stuff like that, and just generally information itself is more important.
I think it's so interesting to see how all of the issues that we face, I think you mentioned this before, one of you, about how these are issues we've been facing forever. Lack of communication and the spread of information is something that just cuts disabled people off. If you have a hearing impairment, you're not going to get that information. It's just compounded right now because of the urgency with which we need information. So I mean, as somebody who uses social media as much as I can, I don't have a huge following, but I'm trying to spread as much information as possible. And I think that's key. But like you say, so many people without internet, without phones, how do we get to them? And so I'm hearing it's partly we want to lean on our government, but partly we want to take control for ourselves and give that information. So I guess it's a joined up effort, isn't it? We need both.
It is a joint effort.
Yes, it is.
Yeah.
Yeah, and I think we also have to use just our spaces, because if we don't speak out, they will think we are fine.
Okay.
Yeah, we're okay. So yeah, I think it's a high time that we used whatever spaces that we are in
Yes.
to call out and make the noise.
See,
Yeah.
I find
So that they realize there's a population that is being left behind, and that is equally affected by the epidemic, just like everybody else.
So I just want to thank all of you. I hope this was useful. Thank you so much for your openness and for your willingness and for your time and energy. We've come to the end of our session for today, and we're so grateful for your participation. Let's remember to continue the conversation on our social media platforms. If you would like to join the conversation as a guest speaker or discussant, please get in touch by sending an email to paza@this-ability.org. Remember to like and share our content on Twitter @Paza Podcast. For more content on Disabilities work and projects, please follow Disability on Twitter and Instagram @this_ability_KE and on Facebook @disability.ke. Speak soon and stay safe.